Assalamu alaikum wa rahmatullahi wa barakatuh. Good afternoon, ladies and gentlemen. Welcome to the American Hospital Dubai. Before we begin our program today, it's my pleasure to introduce our guest. His Excellency Paul Malik, Consul General of the United States of America. His Excellency Theyab Al-Rashidi, Consul General of Kuwait. His Excellency Saeed Mulla, Chairman of the Board at the American Hospital Dubai. Dr. David Hayes, Medical Director for Mayo Clinic Care Network. And Dr. Layla Marzouqi, Director of Health Regulation at Dubai Health Authority. And now, I would like to introduce Mr. Peter Makowski, Chief Executive Officer of the American Hospital Dubai.
Thank you, Ghanem, and thank you all for coming today. We really appreciate it. Now that Ghanem has made some introductions, there was an introduction made of a specific individual from a specific place. So you may now guess what we are here gathered to talk about this morning. And I really do believe that what we're going to be discussing really is going to be a game changer here in Dubai and for the UAE. It's a very historic occasion. It's not often that we can genuinely claim to be making history, but today really is an historic day for Dubai and the UAE. It is my privilege to announce a clinically significant collaboration between American Hospital Dubai and the most respected, recognized healthcare organization clearly in the US, if not the world. And now I'd like to turn your attention to the video behind me.
In healthcare, seeking new knowledge gives us the spirit to innovate, the power to transform lives, and the expertise to deliver extraordinary care for all. We understand excellence is achieved through collaboration and constant evolution. That's why we at American Hospital Dubai are proud to be the first hospital in the Middle East to become a member of the Mayo Clinic Care Network. Now our physicians can work with the specialists of Mayo Clinic to help solve complex medical conditions. And our patients can benefit from our collaboration and combined medical expertise right here in Dubai. American Hospital Dubai and Mayo Clinic together, delivering better health in the Middle East.
No doubt, Mayo Clinic is a leader in healthcare. In the U.S., it is ranked #1 in more specialties than in any other hospital. Mayo treats more than 1.4 million patients per year, and its practice is supported by its commitment to research as well as to education. Today, American Hospital Dubai officially becomes the first hospital in the Middle East to be selected to join the Mayo Clinic Care Network. Today, with this announcement, the Mayo Clinic Care Network consists of 40 outstanding healthcare organizations, primarily in the U.S., but also has a network of hospitals that extends outside the United States in Puerto Rico, Mexico, and Singapore, and now Dubai. Through the network, the Mayo Clinic extends its know-how and its expertise to organizations that share the same commitment to patient-centered care. To be selected to join the Mayo Clinic Care Network is truly an honor and a testament to the quality and to the commitment of the American Hospital Board, the hospital team for the past 20 years. It also represents a pioneering achievement for the hospital as we celebrate 20 years of caring for patients from across the region in 2016. American Hospital's unwavering mission commits us to providing high-quality, cost-effective, American standard healthcare which meets or exceeds the standards that our patients expect from us. And further, our vision is to be the best private healthcare institution in the Gulf region. We are rightly proud of the accomplishments here at American Hospital over the past 20 years in terms of our clinical quality, our patient satisfaction, and patient safety. From our beginning, American Hospital has been a pioneer in the delivery of healthcare, and our innovative approaches to providing high-quality healthcare have been widely recognized. This latest success is the result of the efforts of an extraordinary team of 1,200 colleagues, 100 dedicated physicians, and a very supportive community. Over the last 20 years, our journey has passed major milestones, and today we take a next significant step in our journey. But this has not been quick and an easy step to take. This relationship with Mayo Clinic is years in the making. Discussions first began in 2013, but the chairman of the board, Mr. Saeed Mulla, kindly told me, Peter, I have had an aspiration for this collaboration for 18 years. Our announcement today reflects a close clinical collaboration with one of the world's great healthcare institutions and one of the healthcare's most trusted names. It's a reward that has been hard-earned. American Hospital underwent a very rigorous evaluation and due diligence process to confirm our eligibility to be selected to join the Mayo Clinic Care Network. The intense due diligence process required a lot of hospital-specific data on quality, on patient care, on patient safety, on patient satisfaction, IT, nursing, and strategic information. The information that we provided went to a review team at Mayo Clinic, which scrutinized the documents page by page, and then a team from Mayo Clinic came to the American Hospital for 2 full days, and they asked us a lot of questions. They went through our facility, they met with staff to make sure that the documents that we had presented truly reflected what we said it is that we do. As a result of our outstanding performance, American Hospital is now proud to be the first hospital in the Middle East to be invited to join this prestigious network of hospitals and to establish a new formal clinical collaboration. Mayo selected American Hospital to join the Mayo Clinic Care Network for 3 primary reasons. Firstly, we are like-minded in our approach to healthcare, which means we put our patients first. 2, we also share a common philosophy, a commitment to serving our respective missions. And thirdly, we are culturally aligned. We agree that working together will improve the delivery of healthcare and will benefit our patients. Collaborating with the Mayo Clinic as a member of the Mayo Clinic Care Network means that together we are delivering a new healthcare model to the region, bringing even greater focus to patient care, improving patient outcomes, and advancing the science of healthcare delivery through best practices in evidence-based medicine. So what does this all mean now for the community here in Dubai? The goal of the Mayo Clinic Care Network is to bring the benefits of Mayo Clinic expertise closer to our community so that patients do not feel that they have to travel outside of Dubai for treatment. This collaboration is not about bringing Mayo Clinic physicians to Dubai, nor is it about sending more patients to the Mayo Clinic in the United States. It's about working together to share clinical expertise and benefit from the Mayo's extensive experience. And through this relationship, to bring Mayo Clinic standards to American Hospital's patient-centered care. By sharing knowledge, we can advance quality health care and augment the world-class care that our physicians presently provide to their patients. American Hospital physicians will now have access to the knowledge and expertise of over 4,200 Mayo Clinic physicians and scientists. All 3 of Mayo Clinic's major campuses in the United States will be engaged. And what that will translate to is to directly stronger working relationships and enhanced patient care. This really is a win-win for everyone, for our patients, our families, our community, and for the UAE. It supports Dubai government's commitment to promoting healthcare tourism, connecting Dubai to one of the world's most respected healthcare brands, and making the highest quality standards in the U.S. a part of the unique experience and care of the American Hospital. Inevitably, after much immense undertaking to establish this collaboration, There are many people who deserve recognition for making this day possible. I deeply appreciate the contribution and commitment for all those involved, but there are several people that I would like to highlight in particular. First is the chair of the board, Mr. Saeed Mulla, who persevered for almost 20 years to drive this day.
Thank you.
Our senior leaders who really helped pull all the information together that Mayo went through to determine that we were more than eligible to serve in this network. To Sandra Peters, our Director of Performance Improvement and Quality, who willingly took the task of assimilating all this data that we gave her and putting it in a cohesive fashion so that the Mayo Clinic could certainly go through it. She did an awesome job. Mohammed who is our acting manager of marketing. Was that Mohammed that led that applause? You're good. You got your plants in the audience, I can see. But with his efforts, you're going to see a media blitz like you've not seen in Dubai for quite some time. So be prepared. It's going to be just an awesome performance. And I'd also like to particularly thank two of our Mayo Clinic colleagues who guided us through this very demanding process. First, the Administrator for Provider Relations, Mr. Smale. Mr. Smale, where are you? He made numerous trips here, and he was there at our side all the way through the process. And when the chips were down and we were wondering if we were going to make it through, Smale was always there saying, don't worry, you're getting there, you're making progress, you're going to do it. It's like the little engine who could. And thank you for that guidance. And then the second person that we'd really like to thank, and you're going to hear from in a moment, is Dr. David Hayes, who's the Medical Director for Affiliation Practice Network. Dr. Hayes. He too made numerous trips to Dubai and helped provide us with all the support and guidance that we needed. And as we went through this process, as I said, it's a little over 3.5 year process. Both of these gentlemen were there who really helped convey and tell our story to the Mayo Clinic board and convince the Mayo Clinic board that the American hospital was certainly worthy of this. There are also individuals that there's just too many to mention that really put their heart and soul into this. As I said, it was not an easy process. And again, without really our 1,200 colleagues who work here and our 100 dedicated physicians, again, this day certainly could not have been possible. We are excited. We are thrilled about this collaboration. We are optimistic that it's going to usher in nothing less than a new era in healthcare here in Dubai, not only for American Hospital, but for the entire healthcare sector in Dubai, UAE, and the GCC. But most importantly, it's going to transform healthcare here in Dubai. It is now my pleasure and honor to introduce the chairman of the board, Mr. Saeed Mulla.
Thank you, Peter. Thank you. Assalamu alaikum. Welcome, Your Excellencies, guests, invitee. First, I think I would like to thank the Mayo for this professional respect, I call it. This has taken us a very long time to realize where we are now with the Mayo. Going back, I think this relation is 20 years in the making, but we really did not reach it only today. We had a relation when we opened, and we tried to do something at that time, but I think that was not visible. But now we are here, and I'd like to thank you for being with us and working with us. This is would mean a lot to patients, families, community, everyone, and now you have colleagues and friends in Dubai. Thank you.
Thank you.
Thank you.
And now I'd like to honor you with Dr. Hayes, again, the medical director, who is just very much an inspiration to me and to the organization. And it's because of people like Dr. Hayes that makes this affiliation even that much stronger. Dr. Hayes.
Thank you. Thanks very much, Peter. First of all, on behalf of everyone at the Mayo Clinic, our CEO, Dr. John Noseworthy, and the 60,000 employees we have worldwide, we are every bit as excited to be here as American Hospital is for us to be here. So thank you. About an hour ago, an email went out to all of our employees that American Hospital Dubai was a member of the Mayo Clinic Care Network with information about the facility, about the organization, and we really couldn't be happier because, as you've heard from both of the previous speakers, this has been a long time in the making. So again, for Your Excellencies, the distinguished guests, press, ladies and gentlemen, thank you for having us here today. Let me go back a little bit and say that in addition to this 3-year journey, and Mr. Saeed said actually it's been a 20-year journey, for a number of reasons, I've been coming to Dubai very regularly since 2005 and have watched this fantastic city grow, but it's also watched American Hospital grow. And so it is really a great sense of pride that we see this come to fruition today. Just a little bit about the Care Network and about Mayo Clinic. First of all, as Peter said, Mayo Clinic, we have 3 major campuses. All of us that are here today, our team is in Rochester, Minnesota, which is the corporate headquarters for the institution and the largest of the campuses. We also have campuses in Florida and Arizona. Again, about 4,200 physicians and scientists on our campuses. The Mayo Clinic is all about the needs of the patient. And if you ask anybody that works at the Mayo Clinic, regardless of their position, what is Mayo Clinic all about, they will say our mantra, which is the needs of the patient come first. And if you push them to explain that, they will tell you how, as a physician, a nurse, a secretary, a custodian, why their job makes a difference to the ultimate care of the patient. And if you look at our logo, there are 3 shields. The center shield being for patient care and the outer 2 shields for research and education. Although we're focused on the patient, to be a cutting edge organization, we feel that has to be supported by research and education. We're 151 years old. We celebrated our 150th anniversary last year. We are the first multi-specialty integrated practice in the world. We work as teams of physicians and caregivers. We're unusual in many respects. One of them in the U.S., fairly unusual that all of the physicians are salaried. So that what we do doesn't in fact affect what we're paid, but it's all about what's best for the patient. We're nonprofit. Anything in excess at the end of the year goes back into research and education to support that mission as well as the clinical facilities. Why did we form the Mayo Clinic Care Network? And we're now about 5 years into this venture. So compared to our 150-year heritage, we're really in our infancy in the Mayo Clinic Care Network. We formed it because, as for those of you that have watched American healthcare in recent years, there are many mergers and acquisitions. Oftentimes, at least to some of us that are there, don't make complete sense. Mayo Clinic feels that mergers and acquisition may actually lead to increased fragmentation of care, and we're all about integration of care. And we think it's better that if we form collaborative relationships, such as the one with American Hospital Dubai, that if we're able to extend knowledge and expertise, if and when it's wanted by the physicians and staff and patients at our member organizations, that actually helps integrate care more. What's in it for Mayo Clinic, you might ask? Well, our most important asset are our employees. Our second most important asset is our brand. And we have the luxury of having a very strong brand over, again, a century and a half. We actually find that by working with very strong, independent, regional organizations, not just their brand hopefully becomes stronger, both of our brands become stronger. And people in the region hopefully will know us even better. So we find this in the last 5 years to be a very successful way to extend the things that Mayo Clinic does. I'm not going to get into detail on the tools that we use, but I'll just mention very briefly that anything that we offer to our members, American Hospital Dubai, our other 39 members, we only use tools and services that we use internally by our own staff. That helps to integrate this process with our own activities. So remotely, we extend electronic consults, or if you will, second opinions across any medical or surgical specialty. Our repository of vetted Mayo Clinic medical information called Ask Mayo Expert. Electronic tumor boards for complex cancer care, patient education material, conferences that we put on at the Mayo Clinic that can be accessed by physicians or caregivers here to watch whenever they want to. And finally, something we call healthcare consulting, which is really a sharing of Mayo Clinic best practices. So taking the blueprints that we have based on everything we've ever done at the Mayo Clinic, assisted by 300 plus embedded system process engineers across our organization, we can work with a member who may say, this is what we want to do, this is an initiative we're trying to undertake. We can work with them, take what we've done in the past, alter that to fit their organization, and hopefully move them from start to finish much faster and less expensively. Again, since we're relatively young, our tools and services continue to change, continue to morph. So as we meet with our members on a regular basis, Peter was there a few months ago to see how this works. If we hear from members that new tools and services are needed, we'll do what we can to extend those across our network. So in summary, this is all about collaboration. Physician engagement is important. Administrative engagement is important. For us to know what is needed in Dubai as we work with American Hospital is important, and all of that will come in time. As you've heard from both Mr. Saeed and Mr. Makowski, a lot of hard work up until this point. But now additional work begins as we really do start to extend that knowledge and expertise, get physician engagement, and learn to collaborate and work together. So again, my thanks to the staff at American Hospital Dubai, specific thanks to Peter and to Mr. Saeed, and the entire staff that I won't try to mention that we work closely with, my entire team, a number of whom are here today, and the staff at American Hospital will be seeing a number of us over the coming years. Thank you for having us. We're very excited to be here for this historic occasion. Thank you very much. One last thing. Let me give this to Mr. Saeed. A crystal, a very heavy crystal, Mr. Saeed, that says Mayo Clinic welcomes American Hospital Dubai.
Thank you. Thank you, Dr. Hayes. Really appreciate it. And we will find a very appropriate place for that plaque. What we're going to do is we will be available to take any questions that you have for us. We wanted you to have the opportunity to mingle amongst yourselves. There's refreshments outside for you to enjoy. And if you have any questions for myself, for Dr. Hayes, Mr. Saeed, please feel free to address us with those questions. As you can see, we are very, very excited about this. It's not just great for this hospital, but for, more importantly, the people. And that's what it's all about. Thank you.